This is a really important concept that I want to speak to you about before we get into the explanation of CFS, and we will talk about it in another session as well. Basically, you probably want to get better as soon as possible so that you can get on with your life, right? That's great, but I would suggest that you come at it from a calm place rather than a stressed out place. Accept that the condition is here for the moment and be calm about the process of recovery rather than wanting it to happen yesterday. Give it time, be patient. Also, don't be so eager to get better quickly and get back into the hectic pace of life. Once again, as I said, we will cover this in a future session. But what I'm getting at here is that patients often are in such a rush to get better that they put a lot of pressure on themselves to do so. But the more pressure you place on yourself to get better, the more you are unknowingly stimulating your nervous system, stressing yourself out. It is better that you give yourself time and space to heal. It's a bit like having a scar. A scar takes a while to heal, but if you keep picking at that scar like this, then it will take a lot longer to heal. Relax and give it time, even if this may seem impractical. Remember, your health and getting better is the most important thing. Also, patients sometimes put pressure on themselves to get better because they feel guilty for not working or achieving, or maybe they don't feel they are contributing to society. They want to get stuck back in and drive life forward. Once again, I would suggest that in order to take the pressure off, give yourself at least 6 months to a year of not putting any pressures and expectations on yourself in terms of how much better you will get in that time or in terms of getting back into work or education. So you have a whole year potentially of just enjoying being better and relaxing and recharging your batteries before having to think about going back to work or full-time education. I normally tailor my one-on-one sessions to a particular patient and their stage of recovery. Now obviously with DVDs I don't have that luxury, and therefore it will become your responsibility to tailor what I am saying to your personal circumstances. Some of you may be bedridden, for instance. Some of you may be working part-time or even full-time. So please be diligent about what you put into practice and what you're not quite ready for. I will help you along the way with this. Remember also that this is a retraining program and not therapy as such. And there is a big difference. Training means that essentially you are in charge of your recovery and training yourself. No one else can do this for you. This can now be your responsibility. Now the word responsibility comes from the ability to respond. So it is not a burden to get better, rather it is a freedom to get better with your own skills. You are in charge and responsible for your recovery, and I will give you powerful guidance on how you can do this. Unfortunately, no one else can help you get better apart from yourself and what you learn in this program. You are in charge and you have all the resources inside to do this. I really believe that you can do this. To help you apply things to your personal circumstances, there will be worksheets that I will ask you to fill in and then place on your bedroom wall. Now I can't be there with you to make sure that you are doing this, so please do make sure that as we go through the program that you engage in all the exercises and that you do put the worksheets on your bedroom wall. Sometimes what happens is that people do get better from my treatments, but then for whatever reason, if some symptoms come back, they sometimes forget what they have to do, or aren't as hopeful anymore. Remember that your recovery probably won't be linear, and there will be some ups and downs along the way. This is normal, and it's about staying positive and focused with all the tools, whether you're feeling good or not. If you got better once using this treatment, you can always do it again. And you can always re-watch some of the DVDs to remind yourself of what to do. almost now expect that as you get better, there will be ups and downs. And if you accept it now, then it won't be a big deal if they happen, because you would have already decided ahead of time that you will be relaxed about it. So yes, there will be dips, but that is all part of the journey of getting to recovery. Stay centred and calm if it happens, and you really will get to recovery. Now, if someone said to you right now that you will be a lot better in 6 months' time, or even fully better in 6 months' time, but you just had to do one thing, I bet most of you would do whatever it takes to get better, right? Well, I want to give you that assurance, and trust me, I don't do this lightly. I hope you will put your confidence in me and do all the tools in this program consistently and continuously for 6 months, no matter what happens. Now, this is obviously going to require you to let go of that natural cynicism that you may have for this program. Therefore, only go ahead with this program if you are prepared to let go of that cynicism. Let me repeat that. There will be part of you that thinks, this can't work, it's too easy. I've tried so many treatments, nothing's worked. What's the point? What's to say this is going to work? Now, I totally understand this viewpoint. I felt the same when I was ill as well. Now, natural cynicism and the rational, analytical mind, they are both useful tools for life. But when it comes to your own emotions and beliefs in getting better, they can compromise your ability to move forward. So I want you to make that commitment to yourself now, that before we get into this program, that you will let go of that cynical part of your mind for just 6 months, and that only judge this program in 6 months' time. That whatever happens, you'll give it 100% for 6 months, and then you will judge whether it has worked or not at that point. You will simply keep going with the program no matter what, being open and willing to put your own commitment in. And as mentioned, I am so convinced that this will help you that if it doesn't, then you can return it and get all your money back anyway. So you've got nothing to lose. So now, only continue watching if first of all you make that commitment to yourself right now.